There is nothing called risk factor at all. You can reduce somebody's blood pressure, you can reduce somebody's sugar, you can reduce somebody's cholesterol, you can reduce everything, his height, weight, everything you can do. But you can't change the risk. What is the risk? Premature death, precocious death, disease. The disease, if anything, has increased after we intervened. Why? We are following the wrong science in medicine. The blood pressure has come down. You're so happy. You're very happy. See, the blood pressure has come down. I have a study. I've shown. I'll present. What happened to the patient? Nobody bothers. Can I make an appeal to the outstanding delegates to come in, please? Quite a few of them are there. And why have all the delegates chosen to sit in the back benches? Because I still remember when I joined as a junior teacher, I had a very strict dean in the medical school. He called me and said, young boy, take care of two sets of students in the class, the last benchers and the front benchers. Rest of them will look after themselves, he said. I didn't have the courage to ask him why he said what he said. When 10 years later he was retiring, and in the farewell meeting, I asked him, sir, you said this to me 10 years ago. I couldn't ask you at that time. Tell me why it is so. So do you know what he said, the backbenchers? He said, look after the backbenchers because they have not come here to study. They have come here to enjoy life, get a degree, and become politicians soon. And they'll be ministers, your bosses, so be careful of them. The front benchers are the muggers. They will mug up every word in the textbook and pass the exam very fast and become your colleagues, junior colleagues. Look after them because having a bad junior colleague is very difficult in life. Very, very sound advice. And I always look at the backbenchers with a little suspicion. What are they here for? Anyway, friends, I must at the outset thank Lakshmi Rao, whom I had seen only this morning. You would be surprised. She had not seen me either. And how did she trust me to give a key? God only knows. But she was insisting. She was like a, leech. We use leech in treatment. The leech bites you and sucks your blood, but doesn't hurt you at all. She wouldn't take a no for an answer. And thank you, Lakshmi, for having me here. I'm very happy to talk to physiologists, whom I consider as the most important teachers in the medical school. My only sorrow was, when we were all students, those who couldn't get any other area and those who had taken a long time to pass MBBS, these are very experienced people in the medical school. They used to take to physiology, anatomy and all. Things are changing now. Bright boys and girls are taking to physiology and anatomy. Because my concept, a physiologist must be a professor of medicine. He must teach from day one till you die, if he can teach you. Because it's, after all, it's physiology. That's the whole thing is physiology. And what is disease? Altered physiology. That's all. There's nothing else. So physiology is important and we must have brilliant physiologists. I hope India will in future have brilliant physiologists. The one way you can attract them is be very good teachers. A teacher is a role model for a student. And if you have a brilliant teacher like Kutti, and then they say, should be like Kutti, that's where they become physiologists. So we all used to have role models in our teachers. And he said, those were the days when we said, I must be someone like him or her. And today it's not like that. Today the boys and girls want which specialty gets you more money quicker so that you can have a lot of money. That's the change, sea change there. I still remember the days when we were even abroad for that matter. In the canteen and all, you sit and people talk, I love ophthalmology, I love physiology, I love this, I want to do. Today you go there, they say, hey, it's better to have ophthalmology than cardiac surgery because one surgery takes about 14 hours and then no sleep in the night. And in the time you can do about 10 cataracts and get 10 times the money that the cardiac surgeon gets. So I want to be an ophthalmologist. And now the latest craze is I want to be a diagnostic radiologist. In the olden days, we used to call them photographers. Even physiology, then they become radiologists. Today, no, they are the first because you are an interventional radiologist. You get tons of money. You know the meaning of the word interventional? No. There are three meanings for that in the Webster's dictionary. The third one is very important. Intervene, it means go in between with malice. That is the intervention that we do. The divine interventionalists tell people that I can do anything and I can correct everything. Unfortunately, the end result, the number of people who go home horizontal vis-a-vis vertical has not changed from 1900 to 2013. Did you know that? No, there was an audit at Christie's in Manchester, one of the oldest and probably the best cancer hospital to date. They have records from 1841. Somebody recently wanted to see what's happening with all our recent treatment. They took one disease, chronic myeloid leukemia, and took two slots, 1900, 1940, 1950, 1990, all 40 year slots. In the first half, we had one treatment, TLC. You know TLC? Tender loving care. In the second half, we had so many things, busulfan, this, that, splenectomy, what have you. But unfortunately, the audit showed in the second half, more people died because of us. This is a sad story. And today, going to the hospital, people get frightened for two reasons. A, they should have a big bank balance or must have a rich father-in-law. Otherwise, you can't go to a hospital today. It's so difficult. And an American audit, very interesting audit. I want you all to read because we always think American medicine is great and we want to ape it and we do research. That's called Me Too research, copycat research, all American. And do you know the audit in America? The medical establishment is the leading cause of death, followed by cancer low down and heart attack still lower down. And among the medical establishment, the most important leading cause of death, the pharmacologists are here, right? Drugs. Adverse drug reaction. Oliver Wendell Holmes was teaching in Harvard, teaching anatomy in Harvard, wrote a small note. He said, if the whole materia medica, there's a medical box, could be sunk to the bottom of the seas, it will be that much good for fishes and that much worse for that much good for mankind and that much worse for the fishes. This he wrote in the 18th century when there were very few drugs, hardly half a dozen drugs. Today we have dozens, not dozens, millions of drugs. And you can imagine what's happening to mankind today. I'm going to talk to you on a different subject altogether. I have been working on a hypothesis saying that we are following the wrong science in medicine. In biology. Biology has been looking for a holy grail without success even today. You're all biologists, basically, physiologists or biologists. How many of you have read this beautiful book called Submolecular Biology? Introduction to Submolecular Biology. This was written by a Nobel laureate biologist, Albert Zent Georgi. I want you people to read that book. That will open your eyes because what we are doing is what is called reductionist science. Linear mathematics. Higher the blood pressure, the quicker you die. Higher the sugar, the quicker you die. And do you want to know? MRFIT study is the longest study of risk factor intervention, multiple risk factor intervention trial, Mr. Fit, MRFIT, which spent $110 million. Went on for 25 years now. Started with 500,000 Americans screened to get 100,000 Americans for study. And the study, to cut it short, says today that there is nothing called risk factor at all. You can reduce somebody's blood pressure, you can reduce somebody's sugar, you can reduce somebody's cholesterol, you can reduce everything, his height, weight, everything you can do. But you can't change the risk. What is the risk? Premature death, precocious death, disease. The disease, if anything, has increased after we intervened. Why? Because we always do what is called surrogate endpoint research. I have taken the blood pressure. I will tell you about the physiology of blood pressure a little later. Then I have given a drug, which is a chemical. Hello? Given a drug, the blood pressure has come down. You're so happy. You're very happy. See, the blood pressure has come down. I have a study. I have shown. I will present. What happened to the patient? Nobody bothers. Patient has probably met his maker a little earlier than he would have otherwise. This is a sorry state of affairs. This is a sorry state of affairs. This should change. If that should change, we should seriously think about a new science for medicine. How many of you understood when I said reductionist science? Good, good. I'm very happy. Because 3 days ago, I was lecturing in a very important medical college and talking to staff of the medical college. Not one medical college, 3 medical colleges of the university. Its morphology. And what is morphology? Albert Zend-Georgi in his book Introduction to Submolecular Biology says, I don't know what cancer is. Because a cancer cell works exactly like a normal cell. But it may look different in the tombstone. So a cancer cell works exactly like a normal cell. I don't know of any treatment which can kill a cancer cell without killing a normal cell. So friends, chocolate is not sugar. Chocolate is not cocoa. And so human body is not liver, spleen, kidney, brain, heart, lung or leg. Human body is human body.